So in this video, we're going to discuss how to prep the tape for belly support. So first I'm going to measure the tape just slightly below where I want it to go. It's going to go a little bit higher because we're going to put some tension on it. So I'm going to clip my first strip here, and because we are going to need 2 strips for the front, we're going to cut 2 strips there. Then we're going to use a support strip just around the belly, and it should end about here when we put some tension on it. So I'm going to make sure it's a little bit shorter than where I want it to go. So I'm going to snip just about there. What's good to do when you're applying Kinesio tape is to also clean the belly first with some alcohol so that the adhesive tape actually lasts a little bit longer. Okay. The second step is to take your strips and really curve the edges so that it also helps it to adhere to the belly better. Okay. So we're going to do both sides, curving the tape. And also remember, this is pretty much more an adjunct or just a little bit extra support, but I always constantly have my clients doing exercises to help with the lower back pain and any other pubic pain that they're experiencing, but it gives some relief as well. Okay, so we've got our lower belly strip and the 2 strips that we're going to apply on our tummies. So positioning is really important when you are putting tape on. You're going to get into a supine position. You're going to lay on your back. I'm going to lay around because I'm 9 months pregnant. And so it gets a little harder to move. Okay, so we have our 2 strips for the center. They're each going to lie about here. And notice I'm doing this all on my own, okay, in terms of taping. So, feel for my belly button. I want 1 strip along on the right and left sides. I am going to take about maybe an inch off. And I want to anchor it down. Okay. And then I'm going to grab the paper strip and apply about 25% along the belly and then paper it off. Now what's important to remember is positioning. I did mention that. I forgot to tell you that I want to bring my pelvis back for that support. What's the other one? Here we go. And I'm doing the left side, and you can already see that baby is moving around. And so I'm going to hug the baby, bring my pelvis posterior, connect the strip, that's my belly button, to about a little bit low to where my fingers are, paper it off here. Take the tape off. Now, when you're trying to figure out how much tension to apply, that's really 100%. I back down a little bit, posterior pelvic tilt, and layer it on till about chest height. And then I paper it off and tuck it under. So, now here is the midsection part. Again, posterior pelvic tilt. I am going to slip the tape down the middle, just like that. Tuck under, taper it off, then pull, still one side first, stretch, around the belly, and paper it off. Then tuck, stretch, around the belly, and paper it off. Okay. You can also, a good rule is to just rub the tape, say to activate that adhesion to it, and then let's see what happens when I get up. Okay, there we go. That's how we tape. Self-taping for Kinesio tape. So I feel the support lifting me up on my belly and also anterior. So if I let myself go, I'm going to feel a stretch also of the tape. But you can keep this on for 2 to 3 days. I always recommend doing a test patch because as your belly grows, your skin also is a little bit sensitive. If you see any type of irritation, hives, immediately take it off. The other thing you want to do is take it off, soaking it in a lot of oil, and then you'll be able to peel it off when it's soaked well enough. And that's how you start taping a belly.